We are now going to test the ulnar aspect of the thumb area, and it's typically called a skier's thumb injury when this happens. There's the ulnar collateral ligament that runs along the ulnar side of the thumb at the first metacarpal phalangeal joint, which is this joint right here on the thumb. Now, this ligament actually has two different bands, so we need to test it in thumb extension, okay, or just a normal straight thumb position, but we also need to test it in thumb flexion. So I'm going to demonstrate the thumb extension position first. It's important to grasp just below that joint and also just above the joint, all right? Because if I grasp way down here, then I'm not controlling the joint very well. So I want to be quite close to the joint so I have good control of that joint. So I'm going to test her in the extended position. I'm going to take the thumb so that I'm stretching the ulnar side of the joint and see how much movement there is there. Is that painful at all?
No.
All right. I would test this side too, just to see if there's any extra movement. Okay, so I'm going to stabilize just above and below, and I'm going to take her out. And that feels about the same. We've got the same amount of movement there. Normally there's a little bit of what we call joint play, where the joint moves a bit. Now I'm also going to test her in a flexion position. So I'm going to take her down into about a 90-degree position of flexion. And then I'm going to grasp above and below the joint again and do the same kind of motion where I'm trying to stretch the ulnar side of the thumb. And is there any pain with that? That hurts. Okay, she's got lots of movement there, so we're going to compare it to this side as well in the flexion position. And oh yeah, we don't have nearly as much movement on that side. So that would indicate that there's some instability or ligament injury that has happened to that ligament in a flex position. So have you been skiing lately?
I have.
You have, there you go. So most likely what's happened is she's actually had some tearing of the ligament that occurs on this side of the thumb, and we'll need to do a little bit more testing and poking around to determine that for sure.
Why would I feel it in only flexion?
Because of the one band that is been injured. So the band that is holding you stable in the extended position is fine. The band that's holding you in the flex position is the one that's been torn.
Okay.